You're listening to RX Inspiration, the show where we highlight pharmacists across the country making a difference in their communities. I'm your host, Manuel, and I'm coming to you from the home of pharmacy at the American Pharmacists Association in Washington, D.C. I'm joined today by APhA President Randy McDonough, who will be leading today's conversation. We are also joined by Melissa McGivney. She's the Associate Dean for Student Success and Professional Initiatives, and also a professor at the University of Pittsburgh, as well as a member of the APhA Board of Trustees, and she will be our co-host today. Our special guest is Kristen Peterson. She's a gastrointestinal oncology clinic pharmacist at the Rush MD Anderson Cancer Center. I'm excited to hear what she has to say, so we're going to go ahead and pick her brain. So be sure to leave us a comment on what you hear today. Maybe shoot us a like and subscribe and show the show some love. And let's get started. Randy, take us away.
Thanks, Mason. I appreciate it. I'm very excited about having Kristen as our guest today. And I first met Kristen when she presented earlier this year at the University of Iowa with my son. As they were talking about entrepreneurship and innovation in pharmacy. And then we were able to meet up again at, I believe, AACP meeting and got a chance to talk. And so she agreed to be my guest. So I'm very happy to have Kristen. So Kristen, thank you for coming today.
Thank you so much for having me. I'm really happy to be here and to talk with you guys.
Excellent. Well, they gave this mouthful of your title as being the GI oncology clinic pharmacist at Rush MD Anderson Cancer Center. So can you tell me about what your day-to-day responsibilities are as this person that is involved in, obviously, oncology and clinical pharmacy?
Yeah, absolutely. I have so much fun talking about my job because I feel like every day is something a little bit different. But to give a general frame of what I do, every single day I'm sitting in clinic with nurses, nurse practitioners, and physicians. And I'm actively in the middle of all of the action where the patients are being seen, getting to go to their treatment, being intaken for the different medications that they're on. I have lots of different points of being able to, 1, interact with patients, 2, make interventions, and 3, optimize workflow in a lot of different ways, which is exciting for me. And like I said, it can make every day look just a little bit different. And I really try to take proactive measures. And so every day I'm working up patients, seeing, okay, who might be starting a new chemotherapy regimen? If it is a patient that does do that, I can provide education to them. If there's patients that maybe will have a change in their regimen, how can I think about those adjustments ahead of time so I can be prepared and talk to providers about those and be ready, especially since there's multiple providers that are seeing patients in my clinic all throughout the day. So it's very busy, but very exciting in my clinic. And in addition to that, I have some other responsibilities. I'm the chair of the chemo subcommittee in our P&T committee here at Rush. So I'll have some responsibilities with that. I'll be precepting students or residents, and then also have some administrative tasks, which I'm lucky to get an administrative day each week as well.
So that brings up an interesting point because you talked about workflow.
Yeah.
And so as I listen to you, I hear the clinical aspects as you work with the patients, you work with the team, direct patient care. But when you talk about workflow, so do you have management responsibilities? You talk about an administrative day. Tell me about that aspect of your position.
Absolutely. I think that is an exciting component to my job. When I had some previous roles where I was inpatient, it was a pretty defined role compared to my role now, which I feel is more lax. It's not as defined, which gives me a lot of freedom to do a lot of different things. So the leadership component to my job is more formally something like the chemo subcommittee chair, where I'm working with physicians and other pharmacists to try and get medications on our formulary or standardize certain processes within Rush. But in addition to that, I'm also able to kind of on a more informal level, be a leader within our clinic. And so it was my goal when I came into clinic to say, I want to be someone that makes sure our team runs cohesively. They were running cohesively without me, but how can I make it even more so that way? And so a lot of what I'm doing is kind of observing what's going on, If someone had to step away to help with something, how can I insert myself to help within my clinical boundaries? How can I make workflows be more optimized? So how can I make sure that patients aren't waiting to get their chemo, providers aren't waiting to have orders signed, nurses aren't waiting from us to get the patient to treatment, and kind of making all of those things as streamlined as possible. So that's where my proactivity really comes into play.
Do they have a pharmacist in this clinic before you came on board?
No, I'm the very first one there.
Okay.
Yes.
So tell me about the buy-in and tell me how they first accepted you and versus, getting to know you and making some changes when you said about workflow.
Yeah.
So tell me from the beginning to now how that changed.
Absolutely. I felt lucky that when I first started at Rush, I actually wasn't right away brought into the GI oncology clinic. My manager was amazing and essentially created this 8-week training plan for me where I got to meet essentially everybody else on the pharmacy team. So I got to meet an infusion pharmacist who I work really closely with that's dedicated to GI oncology. I got to meet our oral oncology team and our retail pharmacy team. And so though I was going to be new into the GI oncology clinic, I felt really well established in my pharmacy team by the time that I got there. When I met the GI oncology group, it was funny because they had actually said, I'm not exactly sure what to do with you. We're happy you're here, but I don't really know what the best way is to utilize your skills. And so it was important to me, leaning on some of my prior experiences where I had been the first myeloma clinic pharmacist at Duke. I remembered how important it was for me to shadow each individual team member and see what things do they think I could do to help them, what things am I identifying that maybe they don't realize they could have help with, but based on my experience I could bring. And then also just where could a clinic pharmacist step in and provide even more value than something that maybe there's not even something happening there that I could provide, like that really in-depth patient education, like that really true connection with our retail pharmacy team. So we are cohesively, sending prescriptions, getting patients out the door with their prescriptions within a half hour. Those are things that I worked really hard to optimize. And so it starts small. Sometimes some of those workflow improvements are helping to gain trust within the team. So some of those things like, hey, I can take care of that. Or, you want to update this prescription, I'll update it for you, route it for a signature, and I'll make sure that it gets sent. And because I had those pharmacy connections that the team didn't even know we had all of that access to, I could introduce them to all of those pharmacy resources and then be that person that's saying, okay, I will make sure that this person is looped in, that person is looped in, and we get the patient what they need in the best way possible. And then, of course, by doing that, you can get buy-in with other things too.
That is so cool because I think you took a position that didn't exist before, and there's probably some skepticism from the other providers, like what exactly is this position going to be? We take care of this stuff already.
Right.
To a point now where I'm probably anticipating that they see you as being so integrated that what would they do without you? Would you agree with that?
Randy, it really did almost bring a tear to my eye because we have this kind of formal platform that the different providers can use to recognize people within a team. And, it's not something that's necessary at all, but some members of my team put together this like formal thank you or recognition of me that actually went to my manager, which was awesome. I'm like, thank you so much for that. And in that recognition, they had just said like, we do not know what we would do without you. And that was within 6 months of me being there to go from, we're excited that you're here, but we don't know how to utilize you to like, how did we function without you? That was the coolest feeling in the world to hear that.
I bet it was. And I got to tell you, as I, have all my travels as president of APHA, my biggest concern, to be real honest, is that we've done a great job, I think, internally within the profession to talk about our value. We haven't done quite as good of a job, I think, external. And I think what you have done is saying, hey, this is what a pharmacist and a very competent pharmacist can do for you. And they saw value in that. And you've used that value expression quite a bit. And I think that's an important thing that each pharmacist should be thinking about is, what's my value and what's my value expression to the people that I'm working with. So I think you exemplify that. So thank you for doing that for the profession.
Thank you. Randy.
So now I'm going to ask you a question. Is like, okay, you've got a really unique role and you're in a very specialized area. So what kind of training did you have to do to attain this kind of position?
That's a great question. On the more formal side, I completed a first and second year residency. So my first year residency was general inpatient pharmacy, and second year was completely specialized to oncology. Then the very first role that I had, I really feel like my roles led up to my training to be able to get this position. I was an inpatient oncology pharmacist. I got to see hematology, oncology, stem cell transplant. I worked, mornings and evenings getting to see so many different kinds of patients, work through a lot of different problems and do some problem solving for the teams that I was working with. And then just being able to think on the fly when it came to a lot of things. And while I loved that, and I think it gave me the experience that I needed, I was definitely ready to take on a role that would push me from more of a leadership perspective or from more of a unique type of role. I wanted something different. And so when a position became available within the myeloma clinic at Duke, very similar to my role now, they had never had a pharmacist in their clinic. But kind of on the flip side, they were actually like, we need a pharmacist. They were advocating for one. They saw that other clinics had had clinic pharmacists and they wanted their own. So that was a unique difference of my old position versus this one, is they were begging for me. They're like, please bring a clinic pharmacist into the myeloma clinic, versus my current role, which we had discussed. And when I went into that clinic, that was where I really learned how to form a team and form a team that trusts each other and that has open communication, so that when one facet of that team is not there, or when somebody is away or somebody is on leave, we can still operate at that same level because we understand what each component of the team is doing. And we've trained ourselves enough to know when somebody is away, how can another person step in and either bridge that gap to ensure that patients are getting the best care possible, or potentially, step in short versus long term to help. And so that type of position and getting the confidence from building that type of team certainly was the reason that I believe I was able to get this position at Rush, which is a totally different disease state. I went from hematologic malignancies, myeloma, such a specific disease state for years, to then transition to GI oncology. But my current manager really wanted someone with clinic experience and with that type of leadership experience that could bring together a lot of different facets of the team, including at Rush. I'm lucky enough to have these additional pharmacist resources within GI oncology to create the best experience possible for the team and our patients. Thank you. There were a lot of things formally and informally done. I would say from a more formal perspective, being within the College of Pharmacy at Iowa provides you with so many different networking opportunities and connections that honestly, a lot of those things come from meeting different pharmacists, hearing what they do, especially in a place like Iowa where pharmacists are so incredibly valued. Our training is at such a high level. It's really exciting to hear from those people doing these types of positions in that level at Iowa. But then certainly through my residency training, I was able to glean a lot of these types of skills. Being at multiple different institutions, I trained at Iowa, trained at 2 different locations for residency, and then ultimately got a job at another completely different institution. So I do think that meeting such a different group of people at every place I go, seeing how things are done there, talking to people who have jobs that I would like or who utilize skills that I want to obtain can also help me to incorporate some of those into my day-to-day skills as well. So I'm always trying to make myself better. I'm always trying to take on, new courses or, talk to people that do things that I want to do. This type of job requires you to keep learning and brush up on skills even beyond pharmacy. So that's where I try to spend some of my extra administrative time as well.
Yeah, I really appreciate that, Kristen, as I'm thinking through the lens of what our students are want to aspire to be. You shared your journey and that you're always growing. And I think often that's one of so such a healthy reminder to particularly those that are trying to do and think about something different. That learning really matters throughout your career. I'm curious too, as you've talked about this leadership structure, can you tell us a little bit about how that puts you in the position to really care for patients? Because we'll hear a lot of times that the students want to think, oh, I still want to have that connectivity back to the patient. So can you tell us a little bit about how this has positioned you to really provide advanced care to the individual?
Absolutely. So you're kind of talking about, Melissa, how to marry some of those leadership skills to patient care directly.
Yes.
That's such a good question, because you're right. When we're in pharmacy school, the leadership positions that you take on, it's very direct into, okay, I'm a treasurer for this organization, or I'm, a vice president of a certain, group that you're in within the College of Pharmacy. But I think as you utilize those skills and continue to, either join organizations formally or be on something like a committee at an institution that you're in, you start to learn similar qualities about, okay, how do you keep a team running smoothly? How are you communicating in a way that's clear and that people are all on the same page in an open communication fashion? And it's really easy to take those skills inherently and bring them into a team that you're working on, whether it be other pharmacists, whether it be physicians, nurse practitioners, learners. Those skills are directly applicable. So I would say a lot of those leadership positions do prep you and do give you the confidence that you can be a strong communicator, a strong leader, and that type of leadership and presence that you can bring to any team that you're on will make you a valued member of that team and someone who you can be trusted and really utilize to your potential in whatever team that you're on.
Kristen, as a follow-up, you talked about that you work with other pharmacists. And I'm assuming you work with pharmacists both internal to Rush and then external as well.
Yeah.
Can you tell me, how do you work collaboratively with other pharmacists?
Absolutely. I feel so lucky to have such incredible pharmacy resources at Rush. From a direct perspective, I have an infusion GI oncology pharmacist. He's been there for years. And so he was somebody who actually ended up helping me a lot. And as I started to get into the clinic and get integrated, I would bounce clinical ideas off of him constantly. Does this make sense? Is this something that we typically do? If it's institution specific, what is the historical component to that? And in addition to all of those things, he spends a lot of time gleaning on that proactivity. He's reviewing patients proactively to see, okay, I'm seeing this patient is coming through the infusion area. Did their dosing align from last time? Is there something in the note that I saw that might change their chemo regimen this time or this cycle? And working with me to help clarify those things when the patient is in clinic. So working with him directly makes sure that there are absolutely no holdups from when the patient goes from clinic to our infusion area. We also have an oral oncology pharmacist for GI oncology who is incredible and is doing a clinical review for every single oral oncology patient that we see. And some of these patients fill at Rush, but some of these patients will fill at other specialty pharmacies, like, anything across the country. And she's still doing that in-depth clinical review for every single patient that's coming through. And she'll oftentimes provide recommendations that are very practical, like, hey, we have these tablet sizes. Do you want to adjust the dosing to match this tablet size? Hey, this tablet is on shortage. Do you want to utilize this in its place? Being able to provide some of these very practical and logistical recommendations to help the patient pick up their prescription. Also working with her to communicate, this is when the patient is planning on starting. I'm providing education this day. Here's when the patient needs the prescription by, can ensure that she can set up delivery in a timely fashion. And the other component to that is we have a pharmacy technician who will be doing prior authorizations, looking at different programs that are available to help patients cut down financially on the incredible burden that is oral oncology medications. And all that open communication between them and our team really helps our team understand when can we get patients started on this. And then, of course, making sure that at all these different levels, they're getting the very best care possible, whether someone's catching an intervention, someone's providing education. For those external patients that we do need to send to another pharmacy, our oral chemo pharmacist and technician are setting up a communication directly with that pharmacy to ensure that delivery does happen. And then that gets communicated back to our team. I provide that education even for patients who are having it filled externally. And then in addition to that, we also will oftentimes call those pharmacies if it's not a specialty medication. Let's say it's an antifungal medication or a blood thinner that we can't fill through our pharmacy and the patient would rather fill through a different pharmacy. And I'm calling that pharmacist directly to make sure, are there any insurance issues? This is why the patient is on this. These are my concerns if I have any. And this is what I want you to know. So I'm really looping those external pharmacists in as part of our care team as well.
I'm assuming it's a two-way street too, though, where they need to provide you with information and
Yes.
data because they may have medications that you may not be aware that they are taking. So, and
Yes.
how do you do that within your practice?
Yeah. Those types of conversations are so important, Randy. I think when we have those direct calls, that is a really good time when I see those conversations happening, because oftentimes, the pharmacy trying to call like our general clinic number can be challenging. So we try to provide them with this is a direct number to the pharmacist. If there are questions, you can call this number and not go through the phone tree to get to, the nurse navigator to then get to this person to get to me. So providing with that direct phone number to my phone that I have at my desk is really beneficial in those situations. And like you said, to then get that exchange between both providers. Sometimes I have medications that they don't have on their profile and vice versa. But a lot of times if something is like a longitudinal issue we're trying to solve, having that direct conversation between the phone is by far and away the most helpful, and having that direct line of communication, as opposed to sometimes I feel like, what do you do if you can't get that direct line? You try to send a fax, you try to, find somebody within the clinic, but you're oftentimes not getting to that direct provider. That's a challenge for our retail pharmacists. So building that reputation and that rapport with a pharmacist on site in that academic medical center is really helpful and important. And I like to initiate that because I know how busy the retail pharmacy crew is.
Well, I appreciate that. What we found out in some of the work that we have done is that by pharmacists working with pharmacists, and in the situation that I'm talking about, a pharmacist in a community setting such as us at Towncrest, working with pharmacists embedded in clinics, and in this particular case it was cardiology and internal medicine, is that by working together and sharing of information, we realized there's information they had we didn't have and vice versa.
Yeah.
And when we started sharing that information, we started finding issues that otherwise would not have been found.
Yes.
And so that's why I do think it's important that having that direct line and be able to discuss this with the pharmacist, because we see it in a unique way from a medication management perspective.
Of course.
And that's why it's important that we have those direct lines of communication. So I appreciate you creating that line of communication.
Oh my gosh, of course. Randy, it's so incredibly important. I mean, I would have never caught that there had been, from a totally different prescriber, a totally different health system, a patient had blood thinners sent to their pharmacy. It's amazing what the retail pharmacist can provide us with information wise.
Yeah, we appreciate that. Yeah. Melissa, before I go to my last question, do you have another question you want to follow up with?
Yeah, I am just love what you're doing, Kristen, because you are really quarterbacking in the sense of quarterbacking with your colleagues as a part of pharmacy, with the patients and with the providers. And your leadership skills seem to be a very core part of what's really allowing you to do that. And those are aspects of success that folks often aren't able to really shout out. So, huge kudos to you. And I love the fact that you're able to share this with our audience, because I think sometimes we underplay the value of all of those different connections that ultimately make an impact on the patient, which is what our goal is, right? Is to really help them. So I'm curious if you have some words of advice for our aspiring pharmacists. Those might be students, but I think there's a lot of pharmacists out there that see themselves wanting to take the next leap whatever that might be. And it sounds like you've been able to do that during your career thus far. And so I'm curious if there are some things that have really helped to inspire you to want to take that next step and do something that's maybe a little bit out of your comfort zone to grow that you would want to share with our listeners.
Absolutely. Thank you, Melissa. And I appreciate all of your kind words as well. That means so much. I feel like it's silly having to say this, but the connections that you make through these national organizations are so impactful. And, Randy, of course you know this. Of course that this is something that you advocate for, but I don't know if I would have been able to see the projection of my career and where I could possibly go if I wouldn't have been able to talk to people that were doing some of those things already. And the beautiful thing about pharmacy is, for as vast of a community that we have and all different backgrounds that people have, it is still a pretty tight-knit core community. And you're able to reach out to people, whether it be LinkedIn or when you go to these conferences, and there's opportunities to network and different organizations within these communities that you can be part of, volunteer positions that you can have to start to talk to different people. There's so many opportunities for pharmacists to start to build their repertoire of people that they can go to for advice and really be inspired by. I think seeing other pharmacists do inspiring things makes me think, why can't I? Like, these people did it. These people had success. Why can't I try? I think it's, as it goes for anything, when you see something happen and be successful, it gives you more confidence to give it a try. And that, direct evidence to do so makes it even that much easier. Being able to talk to those people that you're really inspired by. I mean, Randy, you're somebody who inspires so many people. And I think anytime they get to talk with you, they leave feeling more energized and ready to take on something new and exciting. So, keep talking to people that energize you and inspire you, and don't limit to, there's really no limit to what you can do. Keep reflecting on what things make you excited. Keep reflecting on where you want your career to go. That can change on a year-to-year basis. But the more that you're able to reflect on those things and then think about, who could I talk to more about that? Who could I get insight from? And lean on the communities that you're in. I know the College of Pharmacy has always been so supportive for me at Iowa, and they've brought me back to speak about different things. They brought me on their alumni board, and staying connected within my college, connected to current students, I think has been beneficial both for the students and for me, because I'm getting re-energized by talking to those students as well and hearing what amazing questions that they have.
It's all about the connections and networking and just getting to know other people. And I think you've reflected that, and we do appreciate that. In fact, that was so impressive as a final answer that I don't want to go with another question, because I just think you had a great way to end this program. But I want to thank Kristen for all the work that you do. You're just a shining example about what pharmacy can be and should be. And it is very impressive to see that not only are you got the clinical aspects, but the leadership and the administrative aspects that we shouldn't take for granted. But I do think it does come from all the different experiences that you've had, and that you'll be able to combine it now to make it work within your clinic. So thank you so much for your time today, Kristen, and we appreciate you being our guest.